Hello and welcome to today's webinar. We're going to give folks a minute or two to join, so just hang tight and we'll get started soon. Hello everybody. Thank you for joining today's webinar. I'm going to hand it off to Parker Cohen to get it started.
Hi, thank you so much for joining us today for the inaugural Financial Security Network webinar. So let's go ahead and go to the next slide real fast. Thank you. So we're really thrilled to kick off the new Financial Security Network with a conversation around designing responsive cash assistance programs for low to moderate income households across the country. As we all know, cash assistance has long been a tool to support people in getting by and attaining basic financial stability. And in recent years, this approach has really grown in prominence with the upheaval caused by the pandemic, as well as other movements that are growing, such as those around guaranteed income. Further, we know that having the basic cash to meet your needs and attain financial stability is a critical an absolutely critical precursor to building financial security and growing assets and wealth for the long term. So over the past couple of years, we at Prosperity Now have been partnering with some incredible organizations to design and deliver both one-time cash assistance as well as ongoing cash assistance programs. So in our webinar today, we're going to be sharing the results and learning from this work, and we'll be really honing in on a pilot from East Los Angeles, which supported 72 undocumented and mixed status households with $500 a month for 5 months. These initiatives were generously supported by the Wells Fargo Foundation, who have been instrumental leaders and partners in this work. And so we're joined today by Lisa Price, the Vice President and Lead Social Impact and Sustainability Specialist from the Foundation. I'll introduce Lisa in a minute to provide some opening remarks. We'll also be joined by our partner, Elba Serrano-Schildkrut, from the East Los Angeles Community Corporation. And she and her organization have led just the most incredible work in the East Los Angeles community long before the pandemic started, but really supported people in getting by and getting ahead during the upheaval of the last couple of years. So we're really excited to have Elba on the webinar today. So she's going to be sharing some incredible insights on designing responsive cash assistance programs and the really complicated ins and outs of actually executing in these programs. But before I formally introduce Lisa and Elba, I want to go over some quick housekeeping. So first of all, this webinar is being recorded and it'll be mailed to registrants and available online within 1 week. All the webinar attendees are muted to ensure sound quality. You can ask questions at any time or share your thoughts by typing into the text box of the GoToWebinar control panel. So this is on the right of your screen. And if you experience any technical issues, please email gotomeeting@prosperitynow.org. So in terms of getting the most out of today's call, so we really strive to make our network webinars relaxed and engaging. So, join from a quiet space, grab a coffee. Let's say if you're on the West Coast, hopefully if you're on the East Coast or the Midwest, you're having lunch, just settle in, engage, send us your questions and comments, and really be thinking about what you want to take away from this conversation. What can you learn from leaders like Elba to apply in your own communities and your own organizations? So, we want to do a quick introduction into Prosperity Now. So we recently engaged in a new strategy process. So Prosperity Now is honed in on a new mission and vision. And so our vision for the country is we envision an economy that is just, fair, and free from structural racism, one where every person, family, and community has the power to build sustainable wealth and prosperity. And our organizational mission is to drive economic opportunity for all and build equitable economic power. We create impactful systemic change by centering those who have been historically excluded, amplifying community-rooted solutions, and energizing these solutions through research, advocacy, policy, and narrative change. So in terms of today's agenda, right now we're doing some welcome and housekeeping, and right after this, I'm going to introduce today's speakers, and then we'll have an introduction from Lisa at Wells Fargo. We'll then go over the basics of the cash assistance program that Elba led in East Los Angeles. And talk about the partnership we had with them and how the program was designed to be for the outcomes we were hoping to achieve. We'll then highlight some of the data that resulted from the program and what we learned. And then we'll have a really strong conversation with Elba and Laura to talk about all the lessons we took away from this project and what it means for the future of this work and the future of designing responsive programs for communities across the country. We'll then wrap up and close out the webinar. So the facilitators for today's call are myself, Parker Cohen, and my colleagues Laura Yepes, Program Manager on the Ecosystems Change Team, and Ariel Sankar Bergman, an Associate Director on the Ecosystems Change Team. Our speakers today, as I noted, are Elba Serrano Schildkraut, the Director of Community Wealth at the East LA Community Corporation. We're so excited to have Elba join us on the call. And also, as I noted before, we're very thankful and appreciative of the partnership with the Wells Fargo Foundation. And Lisa Price, the Vice President and Lead Social Impact and Sustainability Specialist, has been just instrumental in supporting our work with programs that are delivering cash assistance across the country, and we are so thankful for that support. I'm going to turn it over to Lisa for some opening remarks.
Great, thank you so much, Parker, and welcome everyone. Good morning from the West Coast. So I'm over here with my coffee, and I just appreciate the opportunity to be here today and to welcome all of our attendees as we really dive in to some learnings from this cash assistance pilot project. As Parker mentioned, my name is Lisa Price. I am with Wells Fargo, specifically with the Financial Health Philanthropy team. I have been leading asset building and financial health programs for the last 6+ years. And throughout that time, I've had the pleasure of getting to work with and really partner with Prosperity Now. As many of you probably know, Prosperity Now is really just such a great organization to work with, to partner and implement and test new types of responsive programs and innovative programs where they're really just answering and providing solutions to societal issues. And this pilot program really came out of the critical need during the COVID-19 pandemic to provide emergency cash assistance. And as Parker alluded to, we did do that. A few years ago, we provided one-time emergency cash assistance, and we then took our learnings from that pilot project and realized that something a little bit more stable was needed and more consistent. And that's where this pilot project really was born out of, providing that almost like a guaranteed, income type of cash assistance. And so I'm thrilled for you to hear how the pilot project went and the results from the individuals who were partaking in this pilot, and just really dig into the data. So again, thank you so much for being here, and I'll turn it back over to you, Parker.
Great. Thank you so much, Lisa, for your support and partnership, and really excited to talk through the journey that you just described. So on the next section of the webinar, we're going to talk about the basics of this cash assistance model that we'll be exploring throughout the webinar. So on the next slide, we have Prosperity Now's new approach to our new strategy for carrying out our work. And so this project fit very nicely into our new framework. So at Prosperity Now, we're working to create, identify, test, amplify, and scale new and existing systems-oriented solutions that address the root causes of inequities and racial economic injustice. And in this project, we really started with, as Lisa noted, incubating and evaluating solutions. So what we found in working with cash assistance programs in 2020 was and this is not a surprising finding, but the deep and profound need to support communities that have been left out of broader pandemic relief efforts and have been and are also working and living in an economy that was not designed for them. And so in this project, we have worked to center the community that in particular the East Los Angeles community, to support them in achieving financial stability, or support members of that community in doing so. We've been partnering with the East Los Angeles Community Corporation, who just provide indispensable work day in and day out with their community to lift up this promising solution of ongoing cash assistance. And right now we're in the process of amplifying and sharing the results of this work, with the hopes of working towards long-term policy and narrative change around who is deserving of these supports, and what changes do we need to make in how we allocate resources to ensure that all people in this country have what they need to be financially stable, have opportunities that they need to be financially secure, and are able to be overall well and thriving. So on the next slide, we have a couple of the details that Lisa described. So in 2020, we were starting to do an emergency savings pilot with 4 immigrant serving organizations across the country with Wells Fargo support. And obviously the pandemic hit, and the need for the communities and the partners we were working with changed so dramatically with the economic crisis that resulted from the pandemic. And so with Wells Fargo's support, we pivoted this program to a one-time cash assistance project, found, as Lisa described, through this work that that this was great in plugging holes and supporting people in getting by as emergencies arose, but the need is so deep. And further, there are so many people that are left out of pandemic relief efforts, particularly those who are undocumented And so we sought to design a more longer term project that supported those that had been left out of the universal aim that we had as a country of supporting people through this financial crisis. And so on the next slide, we have a quick poll. So I want to see from all of you out there listening to this webinar, did you provide cash assistance or similar support during the pandemic? Yes, no, or other supports. We'll give you a couple of seconds to fill this out. Great. So it looks like the majority, so 67% of participants or respondents to the poll did provide cash assistance during the pandemic. So that's fantastic. So I think that'll set us up for a really robust conversation, because we'd love to really learn from your experiences, of course, in providing these services, and see what that you hear from Elba and Laura about their experience resonates with you, and what doesn't perhaps, and where are there opportunities for us to learn more. So that's great to hear. So on the next slide, we have the basic program structure. So for this pilot project in East Los Angeles, the East Los Angeles Community Corporation distributed $500 a month to 72 households for 5 months. The program, again, was designed to serve the undocumented population in the community, also some mixed status households that were left out of federal stimulus aid. So when we were receiving the roughly $1,400 stimulus checks, there were many households that were left out of those relief efforts, and this was really targeting those households. The East Los Angeles Community Corporation, also known as ELACC, was delivering additional financial capability services such as financial coaching and other critical services to support people with setting financial goals, managing financial resources. We're also, of course, seeking to measure change over time to understand the real outcomes of this assistance. And so on the next slide, the 2021 project timeline. The first part of the year was really spent designing this program, and so we'll talk through some of the ins and outs of how this was done, how ELACC and Prosperity Now really thought through the ins and outs of ensuring that this was safe, that we had a full understanding of the tax implications for people, thought through how to distribute the funds to folks in the way that was most accessible, and really sought, again, to design a program that was really accessible for folks that were in need of this support. April through September was the distribution period. September through December was analyzing the findings, putting together this public-facing brief and coordinating on amplification activities. And then in the beginning part of this year, we actually released the brief and amplified the great work that ELACC did in Los Angeles. So now I'm going to turn it over to Laura to talk about how she and ELACC developed this partnership and designed the program.
Thank you for that, Parker, and thank you for that great introduction. I want to go into the next section of our partnership and program design by saying that we could not have done this work without ELACC, and I will explain why. The ELACC East LA Community Corporation was a vital partner in this project, and we actually do have Elba on the call. She'll be saying hi later, and we'll have a great conversation with her. Oh, there she is. Thank you, Elba. But we also had such a great team. I want to shout out Fabiola Olivia and Patricia Gutierrez, who both helped us distribute the money, fill out the data collection pieces, be responsive to clients, And a little bit about ELACC. ELACC works on the east side of LA, serving the Boyle Heights and East LA communities through economic development efforts such as affordable housing and advocacy for street vendors. When we wanted to start this project, we knew we wanted to target low-income families in a specific area to help stabilize their individual household finances and increase the resilience of culture by boosting the local economy. ELACC was the perfect partner to do this, as they already had ties to what we deemed cultural entrepreneurs who were the resilience of culture in the East Side. It is important to note that a key success in this project was ELACC's strong standing in the community and their bilingual speaking staff, Spanish speaking staff who are trained in cultural sensitivity. Grassroots organizations like ELACC help us connect to clients meaningfully, as they have already built trust in the community and they deliver high quality services in the client's native language. ELACC was unique in that their staff were bilingual, culturally sensitivity trained, and part of the community already. They were located in our target cities, serving our target population and delivering financial capability services or existing financial capability services. Not only were they part of their community at large, but they also had deep ties to the Mariachi Association and the Street Vendors Campaign, which became our key list when we were looking for who we were serving. They knew their clients intimately and could advocate for specific design, which we will explain a little bit more as we go through the project. And they held trust in the community for their work, especially as they were delivering essential services during COVID. So a little bit about the design process. There were so many pieces of this work that went into how we thought about how we would frame the pilot. These questions were just a few of what we wanted to think about. For example, what, if any, eligibility criteria do participants have to meet to receive the funds? Were we requiring proof? Were we requiring some burden on the clients? And we really had to think intentionally about not only how the money was going to be distributed, but also who was receiving the money. At the end, we decided that these funds would be unrestricted for clients. They would receive they would just be receiving the funds, and we would not require proof of what they spent it on or proof that they were in need. And there was no extra eligibility criteria beyond need or stimulus aid. This project overview shows kind of the list of activities that we conducted with clients, but it doesn't include survey collection time, transcription of interviews into Spanish, translation back into English, calls made to check in on people, financial coaching sessions for those with credit reports, one-off troubleshooting events, and the continued engagement with clients throughout the entire project. Next, I want to talk about why this was such a place-based design, and I think that comes with understanding the location in which we were conducting our pilot and how it helped structure our program. So ELACC works primarily in the Boyle Heights and East Los Angeles, an unincorporated area, and as you can see by our scorecard notable data points, this area is much more impacted by financial barriers, including unbanked and underbanked households, the liquid asset poverty rate being so high, the unemployment rate being so high relatively to the LA County / California / the US. East Los Angeles is an ethnic enclave for Latinos, mainly coming from Mexico, El Salvador, and other Central American countries. In this area, the top quintile earns 4.1 times that of the bottom quintile, which is roughly under 22,141. So there was great need already in this area before COVID. I also want to point out that we thought a lot about understanding the situation of clients in the pandemic for the program structure. Latinos were 2.1 times more likely to test positive for COVID-19 than white people. During the pandemic, most Latinx families with children experienced a 28% increase in food insecurity. So that's really drastic, especially considering how many people had lost their jobs, the income that was completely lost, or that kids were home and schools were closed. Additionally, many Latino and Latinx families were in mixed status households or were part of households that did not file taxes and thus were not able to receive the first rounds of federal aid. A lot of mixed status households were left out of the first 2 rounds of federal aid and therefore didn't even have a little bit of a boat to get them through the pandemic. One interesting fact that I always like to point out is that Prosperity Now's own 2020 national survey found that families in the lowest quintile, meaning the low below 20,000, were less likely to receive stimulus payments from the CARES Act than families in other quintiles, mostly because these households were less likely to file taxes and they were more likely to not have the proper documentation to even file taxes that year. So all that to say is that we really took into account the client needs and consideration, particularly for this population. We knew we were working with a primarily Latino population, so all materials not only needed to be translated into Spanish, but they needed to be translated back into the English version for our revision. We're working with very low income and undocumented population, and this translated to them having a deep distrust in the banking institutions and relying on non-traditional banking methods, which impacted the way that we ended up delivering their cash payments. Additionally, they were less likely to file taxes and less likely to have received stimulus aid. And for the families who qualified for government benefits, we needed to make sure that they were not being pushed off the benefits cliff. So one thing that we had to work around was the tax implications of this money. And we ended up doing a little bit of a workaround in the sense that this was considered a gift from the organization to the clients and therefore would not be taxed in their annual taxes, because we didn't want to push anybody off of the benefits cliff or get them into more trouble. At the end of the day, we were trying to help, not harm. So that's a little bit about how we decided to go about making this particular pilot client focused and client centered. And now I'm going to turn it over to Parker to talk a little bit about the goals, our data collection goals, and what the data looks like.
Great, thank you so much, Laura. So in terms of the goals that we had for data collection, so this was again, really done in collaboration, deep collaboration with ELACC and also with our partners at Wells Fargo. So our data collection was really designed to help ensure that we were asking questions to understand the impact of the work that ELACC was doing, but also ensuring that the questions were culturally sensitive and that ELACC could gather the data that was useful for their purposes. So Prosperity Now and ELACC chose to do a mixture of qualitative and quantitative data collection to ensure that we were capturing changes in key measures such as financial well-being, and we also incorporated the client voice and experience in assessing the impact of the program. So we were initially interested in answering questions like, how did these payments impact household finances? How do they impact participants' sense of health and both physical and overall health, as well as critically mental health? And we wanted to use this as an opportunity to provide additional training and support to ELACC staff on data collection. And what we heard from ELACC was that they were really interested in ensuring that the data could be used to support future fundraising opportunities and in understanding how the payments impacted clients' financial and mental well-being. And they wanted to collect additional information on the mixed status families, since this was a key demographic that they serve. And so our data goals, between Wells Fargo, Prosperity Now, and ELACC were in really strong alignment, and we were able to come together with a really good plan that supported our overarching mission here. And on the next slide, before we want to dive into the data, there is a key point that we want to emphasize. Many of the clients came into this program in a state of true financial crisis. And while it's a short-term program, and so we didn't expect to see a great change on measures such as debt level. Many of the clients in the program did use these funds to move from crisis to financial crisis to financial stability. And so there are many measures where we didn't see a great deal of change, but what we did see reflects the challenging circumstances the clients were experiencing at the baseline of this program. So just to reiterate that point, many clients were in really dire financial straits when they joined this program. The receiving $500 a month for 5 months significantly helped to stabilize them and their financial lives, and the qualitative data that we gathered really demonstrated that. But some of the quantitative data doesn't show a great deal of change in some of these underlying or basic financial measures, but that is okay for a short and what we would expect in a short-term pilot. So in terms of the basic demographics of the program, it was really split into, the participants were split into 3 main client categories. These include mariachi musicians, street vendors, as well as low-income renters. The median age of the program was 46. There's slightly more female participants than male. 11% of the clients identified as citizens, 76% identified as non-citizens, and 12.5% lived in mixed status households, indicating that they had a different citizenship status than their spouse. The mixed status households and non-citizen households were less likely in this sample, and we know this from the legislation, of course, to receive federal assistance. And 82% of participants had no government assistance, and only 13% received any federal stimulus money. The majority were working as self-employed. Nearly 32% of clients made an annual income between $10,000 and $20,000, and 25% fell between $5,000 and $10,000, and 20% fell between $1,000 and $5,000. So a very low income population were enrolled in this program. The group was deeply affected by COVID-19 financially, but also very deeply affected by the health effects of COVID-19. 22.5% experienced a COVID-related death in their families. So the community here, just to underscore this, was really hit tragically hard by both the financial and the health effects of the pandemic. So on the next slide, as we noted earlier, ELACC really wanted to focus on clients who are unable to access other forms of COVID relief. And so 11% of the clients who responded, and so, again, so 82% of clients received no government assistance, and only 13% received federal stimulus funds. So I think this underscores, that the program, the outreach was very effective in finding the households that needed the most aid. And so on the next slide, some basic financial information that we were able to collect. So of the 27% credit visible clients, we saw a slight decrease in the median credit score over the span of the project from 710 to 704. So this is a very relatively insignificant change in the credit score. And overall, we saw 12 clients who increased their credit score and 10 clients who decreased their credit scores. There is an increase in the median debt balance of clients from 1951 to 2010. So again, this is a very small increase, and what we found in the data was that many clients used the money to pay down debts, and some were also using the opportunity to take on debt safely to invest in their businesses. And they receive debt through credit cards, lending circles, and some continue to accrue debt as a result of past due bills. And so on the next slide, although we did see an overall increase again in the median debt for clients, clients said that 38% of clients said that they were able to fully or somewhat pay off debt from family and friends. So this is a very common form of debt that participants had taken on, loans from friends and family. 58% paid down past due bills, 32% paid off debt through lending circles, and 28% were able to pay down credit card debt. And so on the next slide, we also measured the CFPB financial well-being score of clients. And what we saw was a slight increase from 41 to 42.5, both of which are labeled as medium-low scores on this scale. The values are lower than the national Latino average of 50 and the overall national average of 52. So this again, I think demonstrates, the financial precarity of the population that ELACC was really working with. But we were heartened to see an increase in financial well-being, which really measures how they feel about their current financial lives and the future of their financial lives. And where we saw some really positive data on the next slide was around self-reported health outcome. So we saw an increase in how people viewed their own general health, their overall quality of life, their mental health, and their physical health. So throughout the qualitative research, what we saw was a shift from the pre to post surveys of clients indicating that they moved from fair to good. And so this was really positive to see that a lot of folks who were, felt, their mental health status, for example, or their general overall quality of life, overall health, physical health was fair before. More of those people moved into the good category. And, this is something that we're really seeing in other, short and medium term cash assistance programs across the country, or guaranteed income programs, is that you may not see movement on some of these measures around, let's say, debt, in a shorter period. But what we are really seeing is that people are having an appreciable change in their mental health and overall well-being when they receive this support. So this was really, really exciting to see. And so on the next slide, we have, and Elba can go into this more in depth shortly, of course. We found that 80% of clients agreed that receiving the cash payments reduced stress and improved their mental health. 85% of clients agreed with the statement that payments helped them cover their expenses. 56% of clients agreed that the payments helped them pay some of their past debt and past due bills. And 83% of clients said the payments improved their overall financial situation. So what we're seeing when we talk to clients is a really positive picture of how the ongoing cash assistance supported their financial life, their physical and mental well-being, and really helped them catch up a bit in financially, which in turn had positive impacts on their overall health situation. So I'm going to transition it to Laura to do our second poll, and then we're going to welcome Elba into the conversation and learn more about the results of the program. So Laura, go ahead and take it away. Thank you.
Hey guys. So their second poll question, which we'll launch shortly. Are you or your organization looking into guaranteed income or other cash assistance work? The answer is yes, already in the space. Yes, looking to go into the space. Maybe if funding were available. No, this is beyond our current portfolio. And no, we have no plans to enter this space. So let us know. And we'll be closing the poll in about 10 seconds-ish. Awesome. Now to share those results. Thank you. So what we see is that a couple of you, 14% of you are already in the space, 18% of you are looking to go into the space, and then 36% would be interested if there was funding available. And then the rest of y'all are not looking into this. But thank you anyway for being here. I hope this has been helpful and has shown you a bit of how you can structure your program. For the next part of our conversation, I'm going to be talking with Elba. So it'll be great. Elba, I was the TA provider for Elba for the last 2 iterations of this project. So Elba and I have a really good rapport and just have worked together really well. And I want to start by giving her a chance to introduce herself and her work and be able to talk about her own work in her own words. So Elba, take it away.
Hi, Laura. Hi, everyone. Thank you for having me here. Really excited. Thank you to Prosperity Now and Wells Fargo for supporting the work. So my name is Edva, and I'm the Director of Community Welfare Services at East LA Community Corporation. I've been here for, it's going to be 12 years in May, so a long time. So I oversee all of our direct services to both our community and our tenants. We do financial capability work, including financial coaching. We also have a VITA site, so we do free tax preparation. We are a HUD-approved housing counseling agency, so we provide all aspects of housing counseling, including rental counseling, pre, post, purchase counseling, as well as foreclosure prevention. So we have really been responsive to really looking at the needs in our community. As an organization, our mission is to advocate for social and economic justice on the east side of LA, and we've been around for over 25 years. We also, like we talked about, we do affordable housing, as well as we do a lot of advocacy and organizing around issues that are affecting our community, which is how we were able to get involved with the street vending campaign, and also looking at any systemic issues that are affecting our community. So yeah, thank you for having me again. I'm happy to be here.
Yeah, and I just wanted to say, for those of you who saw our Instagram live, Elba and I did a great conversation. I invite you all to check that out because, Elba's just amazing, and has done such great work, not only in this program, but they run so many different programs at ELACC, including a food pantry, which is just phenomenal support during COVID. As always, I'm in awe of how much you all do, but absolutely have loved working with you. So for this part of the conversation, I want to do a little bit of a Q&A piece with Elba just to get some of her thoughts out, and also just guiding us through the learnings from what we've just presented. So I want to start with Elba. If you could say what your #1 takeaway from this work, what would it be?
So the #1 takeaway is the need. We definitely, like I talked about before, is we are in our community and we hear from them all the time. And the COVID pandemic really affected our community, specifically we talked about the mixed status families and undocumented families. During 2020, there was a moratorium on street vending, which meant that most of our community members that were vending on the sidewalk, if you've been to LA, that's part of our culture here, were not allowed to vend. So they were left with no income whatsoever. Many of them, because they were undocumented, were not able to apply for any sort of assistance, including unemployment. We also talked to a lot of mariachi musicians. If you look at my picture here, the background is Mariachi Plaza. This is where a lot of mariachi musicians get their work. Because everything was basically canceled, Most of the mariachi musicians were not able to work at all because there was no gatherings happening. So, and that extended to 2021. So many of them talked to us about having to just, return even some of the deposits that they had received for any of the events that were happening. So that really put them in a really stressful situation. So for us, number one takeaway was really the need is out there. We were hoping we could do more, but this is definitely a start, and we're starting to see more basic income pilots in LA County, which is amazing to see for us, because we do understand that becoming stable is the first step of even looking at increasing your financial capability, or even like creating a budget and things like that. So stability is really important.
Yeah, and when we talked about who we were serving, I think we made it really clear that a third of the clients that we wanted to serve were street vendors, and a third were the mariachi musicians, who are all in the informal economy, and who we call cultural entrepreneurs because we feel like they serve such a bigger purpose than just being business owners. They're really like culture. Can you talk a little bit about your associations with those groups, and like how we found who to serve through them?
Yeah, definitely. So the street vendors, so ELACC has been part of the LA street vending campaign for 14 years. So we keep saying over 10 years, and I counted them the other day, and it was 14 years. So what we've have listened from the street vendors is that they just want an opportunity to work, and we have organized and been able to decriminalize street vending in the state of California. We're currently working to change even state law, so we're working with our partners. We have really amazing partners here in LA, which include Inclusive Action. For the city, if you heard of them, Public Counsel, which is a legal organization, as well as Community Power Collective, who is doing a lot of organizing with the street vendors. So we have a really good relationship with them, and their street vendor leaders. So there's a lot of leaders in the different parts of LA, including Ball Heights and East LA, where they're on the ground and they know the community. So they were able to connect us to the people that were really experiencing a hardship during this time. The mariachi musicians, they actually are very organized themselves, and they have on different organizations where they are able to spread information really quickly. And we were able to meet with a couple of the leaders and the mariachi musicians that were able to help us create a list. We let them know what the criteria was that we were looking for, and they were saying, okay, well, we already have it. We just need to put it down on paper. And so they hand delivered to us written names and phone numbers of the people, and then we did, the work of reaching out to them. For the tenants, we are affordable housing developers, so we knew that a lot of our tenants that were low income were also going to be experiencing a hardship, and many of them are also micro entrepreneurs themselves. So we were able to target them through our resident services team that was able to reach out to our property managers and take a look and see who was really needing the assistance during this time.
Yeah, which is why I always say you guys were just so well positioned to do this entire pilot. Like, you already had the connections, you knew who to target. We did such a great job, I think, of filling our roster so fast. And I know that even after, there was people who were like, how could I get on this? So amazing job. Did you have any guiding principles that you were adhering to while designing this pilot?
Yeah, so we wanted to make sure, and then we live up to our values, and then also making sure that we help the most in need. So whenever we think about our programs, we think about the people that are most in need and how we can support those, so that the others can also be supported as well. So we definitely wanted to make sure that we talk to our community members that were most in need. And, we are, again, positioned on the east side of LA, where most of our community members are Latinx, like we talked about, and, they're micro entrepreneurs, and they're, living in a cash kind of environment where they are not necessarily, being able to have their documents in place. We've heard from a lot of our micro entrepreneurs that, have heard about the PPP loans, and they were not even able to apply for those because they didn't have the proper documentation in place to apply for those loans. And we already heard how hard it was for, even people that did have the documentation to apply for the PPP loans. So for us was helping those in need, live up to our values, really like looking at the east side of LA, which is our target community that we're working with, to serve those people.
And I remember from our TA discussions, a big part of it was also lowering the barriers needed to enter the program. We talked a lot with a lot of people who said like every other program they tried to apply to was just there was so many pieces to jump through. Sometimes they wouldn't even get callbacks. They wouldn't even get a notice that they weren't admitted to something, and they were just like, we just need help and we can't find it. And I remember us having a conversation about, okay, do we want them to bring proof of something? And you were like, no, like this is not that type of program. We're going to keep it as low entry barrier. We're not going to require a lot from them because these people are already suffering and they need help, and us adding to it is just like not helpful.
Yeah, definitely. I think that was really big for me, and that we didn't want to create any more barriers. We already understood the barriers that we're facing with. One example, the Angelino card came out, early during the pandemic, and most of the people that signed up for it weren't even able to provide any information because they were asking them for proof of COVID hardship, which, of course, if you're, undocumented, if you're not doing your taxes regularly, if you don't have a bank account and you're not putting deposits into your bank account, there was really no way of showing that that hardship was happening other than being self-reported. So we definitely didn't want to create any more barriers, and we understood that by us even already creating an application process for them to fill out a survey was already going to be hard for them. So we wanted to make sure that we made it as easy as possible, which included also the data collection.
And I think that was really key in how clients felt about supported through this program. Yeah. So with that in mind, and like thinking about all the good things that we did, what did you feel was the best part of this work?
The best part of my work was connecting to the community again. 2020 was spent working at home and just being on the phone, and not necessarily being as out there as I would have liked to have been. Like you mentioned, we do have the food bank, our monthly food bank, which we run, which was always in person. But many of our services did turn to just being over the phone and even texting our clients. But for this particular one, we needed to make sure that we made ourselves available in person. So that connection, I think, again, and then just feeling how thankful they were about the support. And even many times, many of them asked me, like, are you sure I don't have to pay this back? Is this for real? Like, really, just feeling that how thankful they were, even like with just seeing their eyes with their mask on, and just letting me know how that this money was supporting them. One story that I'd like to tell, I think I mentioned it to you before, Laura, and you were there, is one of our street vendors who sells fruit here in Boyle Heights. He has a child who has special needs, and he had not been able to receive the support he used to receive. And for him, having this cash assistance, he was able to take him to the grocery store and let him know that he could pick anything that he wanted at the grocery store that he wanted to have for dinner. And he said that his eyes just lit up, and he was just so happy to be able to just choose whatever he wanted to eat at the grocery store, which I think, was such, for me, I was like about in tears when I was talking to him. And we still, we talk to him all the time, and his business is doing much better now. He's selling fruit still. Everybody knows his son because he's always working with him. So that, that's just one of many stories.
Yeah, I agree with that. I think that for me too, the best part of this work was hearing the stories and hearing people say like, thank you for listening to me because I didn't feel heard during the pandemic, or I'm glad somebody's trying to listen to our stories. I remember one of the street vendor advocates was like, I don't think people realize how much we go through, how much we have to carry, how much we feel like a burden to society when we're just trying to do our job. And I was just so shook, because I was like, this is what makes a difference, right? Listening to people's stories and amplifying them and having them feel heard and seen and supported by our society. I think that even if we did it with like a very small group of people, it was enough to have made like a little bit of a difference, during these times of COVID. So I guess like my next question is, do you feel that we made a difference?
Yeah, definitely. I think, we talked about it, 72 families, 72 individuals, which many of them reported to have been able to just put food on their tables. Many of them were able to buy inventory to be able to vend, which were the street vendors. Some of the mariachi musicians were able to pay back some of the family members and being able to not have to sell their music instruments, which is their livelihood. Some of them had mentioned to me that they had they were thinking about selling their guitar or their mariachi suits, which to them is their livelihood. So for me, being able to support those individuals and their business and also their lives, I think was definitely made a difference. And I think that because of that, we have continue to make a really good connection with our community members. So our work is being amplified, and we're able to reach out to more of these specific individuals, like the mariachi musicians and the street vendors, and them coming to us. The other part of it was we connected them to other work, which included financial coaching. The ones that had ITIN or Social Security number, we were able to pull their credit reports. We also were able to assist some of these individuals in filing their taxes this year. So many of them hadn't filed their taxes. They were able to get access to the child tax credit because of the mixed status families. They do have kids, who qualify for the child tax credit. So we were able to let them know that they could apply for an ITIN, they could file their taxes, they could actually get this credit that they are eligible for. And some of them were, didn't even know that. And even in California, we have a California Earned Income Tax Credit, which was recently changed to serve people that were also undocumented ITINs. So we had some of these individuals that filed their taxes. They got this California stimulus this time around. So I think that for them, they were just very thankful that, our assistance went even beyond this cash assistance program, and being able to connect them to other services was really key.
Yeah, that's amazing. I think, like I always say, sometimes financial capability service providers go under notice by like how many people they bring in, right? Like just the starting point could be VITA, it could be this program, it could be the food pantry, and all of a sudden you're serving someone for the next 5 years and they're changing their life because of your program. So it's amazing just to see like the continuity and the follow-up that you all do. Just like kudos to you all completely.
Thank you.
So I guess my next question is, what would you say to an organization who is thinking of starting their own pilot or creating their own program? Like, what advice would you give them?
I would say to really listen to their community and listen to their staff. I think, I wouldn't have been able to do this program if the leadership in our at ELACC wasn't, on board. Luckily, I do have that flexibility within the team where I'm able to respond and be flexible and say, okay, this is something that really needed to happen during this time. During COVID, we were able to shift. We used to do match savings program, and we shifted that work to do cash assistance. So we already were set up. So I didn't have to do very much convincing to our leadership that this was a program that we were able to do as a team and that needed to happen during this time. Also being flexible and learning as you go. I think, there's a lot of planning that needs to happen, but we also need to just troubleshoot as things are happening, which we learned with gathering the data. We had sent out we had sent out surveys and we needed to make a lot of just, phone calls and be like, okay, how can I help you? Let me sit with you and let me help you answer these questions so we can get the survey filled out. So it can be time consuming, but if you already have the part of your mission is to serve, low-income individuals, financial stability is part of your mission, then it does make sense to do this work. Obviously having the partners in place is amazing to be able to have a connection to the people that are in need. It's really important. Many of the work that we do is through partnerships, like I talked about. So those are really key to be able to continue to reach the people that need the most support.
Yeah, and I think a little bit about the data collection piece as well for anybody who's a researcher or on the call. Like, we had to be flexible as well with translation. We didn't anticipate how much it would take time and both like money, how much time and money it would take for things to be translated into Spanish and then back into English. And that was like time that like not only in interviews, but time spent translating and getting things together and making it look normal. It was just like much more than we had anticipated, but we knew we were doing the right thing because we were centering the client needs. And I think that was really important as well. Like all of our interviews were conducted in Spanish completely by myself, Elba, and the ELACC team. And so that was really important, I think. And speaking to clients in their own native language, I don't think that should be underestimated how much more comfortable they felt sharing their stories, explaining to us how COVID made them feel, and even talking about finances. It's so hard to talk about your finances when you're in a financial crisis and feel like the person on the other side is judging you. Whereas if someone's talking to you in your native language, I feel like they're much more likely to like open up and really say what's going on and talk about like their difficulties, their challenges, or how they weren't able to access something. I don't know if you remember this story, Alba, but there was a lady who at the beginning of the pandemic lost her job, really needed money, so she put her car in, like, she traded the pink slip of her car for a loan, and the loan was just like an exorbitant amount of payback and was just a terrible terms, and COVID relief hadn't hit in, so like 2 weeks after she got it, they changed the terms where it was like, if you can't pay back, that's okay. But since she got it 2 weeks before they did that, she just could not do anything other than pay $300 a month for like the rest of the 5 or 10 year like term that they had, which was just
Yeah, and
terrible.
it was just mainly interest that she was paying. So I think, we hear so many of those stories too. It's like, predatory lending. If you walk down, Bull Heights in East LA, they're in every corner, because people are underbanked, and unbanked, they end up going to a lot of these, to cash checks, but at the same time, they're being offered this other financial products that are not benefiting them in any way, putting them into further debt. So I think that, the education that we did was also really helpful. We had financial education. All 72, most of the 72 individuals were able to receive at least one financial education course. We had 3 of them throughout the 5 months. And then we also send them texts, and we constantly let them know about other services that we were doing to be able to connect them. So I think that part of that was really doing the education around like predatory lending, around understanding the banking systems, like, really getting them to understand that there's other financial products out there that can support them as well. And really, like, just getting the education out there was really helpful. And, again, like, many of them don't have trust in financial institutions. So, it is a big barrier for us to do that, to be able to just get them to say, hey, you can open up a bank account. You don't have to pay all that money. You don't have to get those loans. We prevented some people from getting those loans by providing this cash assistance, which I think was great.
Yeah, and I also, to talk on the predatory lending piece, that's why we, with ELACC, we decided on prepaid cards to distribute the money, because we realized that if we give them a check, these people are gonna go to like a Wells Union, you know, like places where they would take like 10% of the check or more if they like if it was over a certain dollar amount. So we were like, no, we can't have that happening. Like, so we gave them a
Mhm.
prepaid card that they were able to use anywhere. And so it was really easy, I think. I remember a lot of clients were like, I didn't think it was gonna work the first time I stuck it in, and I was like, this might not go through, but it went in, and they were like so happy. They were like, oh, so the money's really there. But I
Yeah,
think
they were so even after they had it in their hand, they were still like not sure. And then we spent a lot of time, you know, when we did pass out the prepaid cards to really let them know we met everybody in person. Every single person that was part of this assistance came in person. We had a distribution in 2 days, and we spent 15 minutes with each one of them, letting them know, okay, this is how this works, this is how you activate it, this is what happens if you lose it, this is how you get a hold of us, and then also give us the name of anybody else. Obviously, like if something were to happen to you during this time, we can get a hold of somebody else so that they can also receive this fund. So it was a really safe environment for us to be able to just let them know how their money was going to be safe and how we were here to support them.
Yeah, I think that's the key really in creating these programs, just being really intentional about time and dedication to the client's needs. Like, I don't think, again, I always say this, like, you guys were just excellent partners because you knew your client's needs and made time for them. I don't think any other group would have spent like 15 minutes just going through a card thing with someone and explaining to them, hey, this is how you activate it, hey, this is how you use it, because they just don't have the time, right? They can't make the time. But I think you guys were so intentional and knew that these people had either tech or literacy issues. So you were like, okay, let me guide you through these steps. Okay, let me help you fill out the survey. Okay, you need extra help? Cool, come in. We'll have a financial coaching session dedicated just for you. You know, I think that is what made you guys excellent partners. Like, just so much love to y'all.
Thank you.
My last
And
question
then
before we move into the group discussion and Q&A, how do you hope the field moves forward from here?
well, I'm starting to see it, some of it here in LA County, but I hope it does expand throughout the country. I think that, you know, when it comes to funding, we need more funders like Wells Fargo and our partners like Prosperity Now to be able to look at, you know, make the initial investment, you know, and also, you know, being able to trust our organizations that are, you know, already being trusted in the community to do this work. I do hope that there's more changes, you know, all over the country around like policy. I think, you know, policy is really important, and we do a lot of advocating around this work and really, like, you know, saying how important it is to support people, not only during this time. I mean, COVID just made it so much worse. People were already, you know, suffering before COVID, but really COVID really, you know, pointed out all of these issues that were already happening. So I think that systemic change is really important in making sure that there's policies in place that are there to support people. Cash assistance like this, and more stimulus funds, and more things like you know, just being basic income pilots. I hope that they don't end up being just pilots, and that they continue on to be like real work that more organizations and government is involved in.
Yeah, and I agree with you. I feel like the field is moving towards this. It's been such a big thing, such a hot topic, along with like baby bonds. So hopefully this continues this pattern of like helping people in emergencies. I want to thank you again, Alba, because phenomenal, just phenomenal work, phenomenal woman. Just so completely grateful for you and the ELACC team and everything that we did on this project, and being able to support people during COVID was like necessary and needed, and we did the best that we could with what we had, and we made such a huge impact on, even if it was a small amount of people, it was enough, you know, to make a difference. So thank you.
Definitely,
And right
thank
now,
you.
yeah.
Yeah, thank you, Laura. I appreciate it. Just wanted to just express my gratitude for you and the technical assistance you and your team at Prosperity Now provided. We couldn't have done the work without you as well.
Yeah, and I'm sometimes I was like, this is a lot of data collection, but you know, we needed it all. We needed to tell the story. right now we're going to transition to our group discussion and Q&A. So if you want to join in the conversation, please just ask questions. We'll answer what we can. Let me pop out the questions. Somebody wanted to know, what is the prepaid card that we used?
So we actually found a vendor. We were already doing some cash assistance. We started in 2020 with the LA Street Vending campaign. As soon as COVID hit, we moved fast and we did a cash assistance, one-time cash assistance with street vendors. So we were connected to a vendor, and if you send me the email, I can connect you to the name of the vendor. Actually, they changed their name, so I don't remember right off the top of my head, but I know that there's many of them that do prepaid cards, and they actually have a portal where we were able to assign the card to the individual. So if they did end up losing it, that they would call in and they could get a replacement. And our team was also able to log into the portal monthly, so we can do so we can put the funds in there. So it was a monthly, every 15th of the month, we promised them that they would have the money there, and our team makes sure we put that on our calendar. So every 15th of the month, the money was going to be there for them. So we were able to do it on our end to do the deposits every month for them.
Yeah, awesome. Thank you for that. We have a couple of questions from Rosemary Thompson. How many people are on the team that work for this project?
So my team was the three of us that we talked about at the beginning. So I have a resident services program supervisor. Her name is Patty. She's amazing. She connected us with the tenants, but she also helped us with the community. And we have Fabiola, who is our financial coach and housing counselor, and she was also able to assist. We did have one more staff member who's the administrative assistant, who is not with our team anymore, but she was also able to support us during the time to make schedule appointments. So we did have the administrative support as well as the financial coach and our resident services coordinator or supervisor that was able to connect with us tenants. So a total of mainly 3 staff working, including myself, and then part of some administrative support. But just keep in mind that also our job was to also connect them to other financial capability services. So it was also combined with the work that our team was already doing and really connecting them to that.
Yeah. Another question. Did you have to ask for local addresses? I guess to verify eligibility of the east side?
Yeah, so we did get their general information. We got their phone number, their address, as well as just general demographic information about them. And we worked with our partners and also our other community members to do the outreach for us. And we actually didn't need to turn anybody down that was on our list, because we made really clear guidelines from the beginning about who was eligible, and then our outreach was really targeted. So we didn't put this application online. We actually just worked with our partner organizations and our partner community members at the association that were able to connect us with these members that needed the support. So we didn't need to put the application online. Actually, we knew that was going to be a barrier if we put it online, because people, weren't able to fill out the application to begin with. Many of them needed our support to fill it out.
I think related to that, they're asking if a lot of people had their phones turned off, I guess, through the duration of the program.
So yeah, we did have some of the participants that were had to switch numbers, or maybe they were behind on their phone bill and were trying to catch up. But so again, because we had a connection with the people that helped us create the list, like there was a street vendor leader, one of the leaders that connected us with some of these members. She was able to contact us and let us know, hey, so-and-so doesn't have their phone. Please let me know. Please text me or please call me if you need anything from them. And, they're going to get their phone number, a new phone number. So I was able to get it as soon as that person got their new number. So again, communication within the member base and the leaders within the groups was really helpful for us to be able to keep our database updated.
Yeah, also really helpful to have like point people for each group, I think. This is from Carmela Walker. Shout out to Carmela. Hi. Cash assistance programs are vital now. Can you reiterate regarding the time frame of distribution, and how were you all able to choose only 72 households when there were so many people to help? Like, how did you drill down to choose them specifically? And I think you talked a little bit about this with like the associations, but I guess how did the list come to be?
Yeah, so we actually ended up talking to, well, the first part of the question is the time frame. It was 5 months. So we started, I believe, in May, Laura, 2021, and then 5 months after that. So the beginning of the year, the first quarter of the year in 2021 was really talking about the program and really talking to our partners. So what ended up happening was the one specific, the mariachi specifically, is that we talked to there's 2 associations with the mariachi groups, and we talked to some of the leaders there. And what happened is that they actually self-selected the ones just based on their own, situation, and knowing like what hardships some people were dealing with. And we did talk about people passing away due to COVID. Family members passing away due to COVID, just losing their livelihood, and people that had really young children that needed support. So they ended up doing putting names in a drawing, and they actually ended up doing a drawing because we worked with them and we told them, right now it's only 72 individuals. We're only doing 24 mariachis. So they were able to help us self-select. And then one of the mariachi musicians let me know that he was also going to be sharing some of his funds with another family that really needed the support and wanted to make sure that that was okay with us, and let them know that there's no restrictions on how they use the funds. So if they do wanted to support another family, that they were welcome to it. But they also connected us to that family to see if we were able to connect them to the food bank and the other resources that were out there.
Yeah, I remember that. Another question: if people receive stimulus incentives, did they also receive cash assistance from this program? So I guess and I think we answered this a little bit in the webinar. I think only 13% of participants received both stimulus and the money from this program. But was it in your guiding principles that people who received the stimulus weren't going to get a part of this program? I don't think that was what we ended up deciding. It was
we wanted to target those that didn't receive the stimulus, but again, because we didn't ask for documentation, we did end up having, I believe it was 13% of those people that did get the stimulus. But what ended up happening with those people is because they were really severely behind on rent, or had a situation that was either death related to COVID, or really hard time that they needed the extra support. So we actually, took those couple of them where we were like saying, okay, although we do want to target people that didn't get the stimulus, the family circumstances, because we know them and we know what was going on with their family, we were able to include them into the program.
This is from Lisa Florin. How many people ended up participating in financial capability supports, and what do you think were the factors that contributed to those who did versus those who didn't?
So there was about 60% of them that ended up receiving financial capability support. About 80% of them ended up being part of the financial literacy workshop. So we did 3 financial literacy workshops. About 60% of them participated in our financial literacy program. Our financial coaching, and about maybe like a third of them were able to get their credit reports. And then the others, I think I include them in the 60%, were able to be part of our VITA program and get their taxes done. So I think that for those, obviously it was really helpful for us because we were able to look at their financial circumstances and connect them to other resources, and even talk to them about bank accounts and And the street vendors specifically, we were able to help them understand the process of getting a permit in the city of LA and talking to them about registering their business with the city, as well as getting a seller's permit with the state. So we were able to do some education around there, and we're still getting people being referred to us by those people that receive those services. The other people, obviously, I mean, we gathered data for everybody. We did see that there were some of the people that didn't end up doing financial coaching, because we didn't want to make it, a requirement for them to attend financial coaching, again, and not adding more barriers to the program. But we did end up seeing that some people ended up having to get more debt because their circumstances changed also during the program as well.
Yeah, to keep going with the financial capability supports, Jasmine Perez, hi Jasmine, as asking what workshops were offered to them, and were those facilitated and or developed internally?
Hi Jasmine, great to hear from you. So Jasmine's a former colleague who is amazing, by the way. So thank you for asking. So we did 3 workshops. The first one was around the prepaid card specifically, and around budgeting, just talking about like how to keeping track of the funds and making sure they understood how the prepaid card worked, and if they were able to get cash out of an ATM card. So really like talking around like not only the prepaid card, but also like budgeting around it, to keeping track of the amount that was left on there, or how to find out how much was left on there. And then also talking to them about, having other resources, including the food bank. But the other workshops we did was, the second one was around credit. So we talked about credit, because we asked for everybody to fill out a packet where they allowed us to pull their credit report. So those that were able to, we were able to pull their credit report, we sent it to them, and then we did a financial literacy workshop around understanding the credit report, what was on them, and also like inviting them to come in for a financial coaching session. And then those that didn't have credit, we talked about getting their ITIN during that workshop, as well as talking about our Lending Circles program. So we are a Lending Circles partner with Mission Asset Fund, and we're able to support people through Lending Circles program, where they can actually have access to that as well. And then the third one was more of a closed out webinar where we talked about other resources, and then just getting them to look at, how they were, what they were going to do, just having a conversation with them around like, okay, so now that the cash assistance program is ending, what else is out there? So we also talked about the child tax credit, and then we again, taxes was really a key thing that we talked about during this time, and then getting access to other resources as well.
Yeah, I remember all that. Oh my gosh, so much work, so much work. A follow-up question from Rosemary Thompson. Were workshops provided remotely? So yeah, all the calls were Zoom. Yeah. Zoom
yeah,
calls.
I mean, because it was during 2021, we were still, although we were meeting one-on-ones in person, all the workshops were over Zoom. And that was a fun experience in itself, because we did have to do some navigation around like helping people understand how to use Zoom. So we actually sent everybody text, and we sent them a picture of what the Zoom application looks like and how to download it, and to contact us if they had any questions. And then we also sent them a link on the text, so they were able to click on the link, and then from their phone, and be able to get on the call. And we asked them if they needed any support before the workshop, to be able to reach out to us to let us know, and so we can help navigate it. It was so much fun, because some of them was the first time that they were on Zoom. Also, we gave them the phone number, so we did ask them, if you weren't able to get the app, we don't have a smartphone, you can call in, because we did have some elderly individuals, both vendors and mariachi musicians, that didn't have the app, so we gave them instructions on how to call in. There was a couple of mariachi musicians that were in their suits, because they were saying, okay, we're about to go do a gig right now, but we're here, we wanted to let you know. and just doing a roll call to take attendance to see who was there was a lot of fun. So I think that was just a learning experience as well, and then helping them get connected. But yeah, they were all over Zoom during that time.
Well, we have time for 2 more questions. So another question that came in is, was there any LA specific challenges, place specific challenges that you faced that with these clients during this time?
I mean, yeah, I think one of them was, again, we talked about the digital divide. People that are, a lot of the people that we were working with, they didn't have access to the internet, so that was a challenge. And I know that that's probably a challenge a lot, in other places, but for us specifically was really a big challenge. The other one was just scheduling people to come and see us. Luckily, we targeted people that were on the east side of LA. So if they knew Boyle Heights and, they were on the east side and East LA, they knew how to get to us. But some of them did have to get on the bus, and we did have to be flexible and rescheduling for when we did the distributions, to making sure that we made ourselves available when they were able to get to us, because some of them couldn't make it. And then there was also COVID as well. So, when we did have some individuals that were sick and that weren't able to come pick up their cards during that time, and we had to talk to their family members and figure things out. So those, I don't know if they were really LA specific, but I think because of the population and because of who we targeted, definitely saw some of those challenges during that time.
Yeah, COVID was definitely, I think, LA specific in terms of like how bad we were hit by Delta. Delta was really bad in LA. And particularly for the Latino community, I think there was some statistic like 5 to 1, like 5 Latinos to every 1 white person got sick with Delta, and we lost so many people during that winter period. I remember. Oof.
Yeah.
I think this is the last question that we'll take, and it leads us right next into our poll question, which is actually, do we have any tips for advocating for cash assistance program with state legislators? And Elba, you do not have to answer that, because our next question for our poll is going to be, if you are interested in this work, interested in continuing the conversation around advocacy, around guaranteed income, cash assistance, would you be interested in talking through a town hall, a working group, another webinar with experts from the field, roundtables with participants and other stakeholders, or just other? And I'll give you guys another 20 seconds to fill that out. Awesome. Let's see what people have said. And most of you want another webinar, okay? Some of you want to join a working group. Roundtables is a really good option, I feel like, and some of you asked for a town hall. So we'll keep this in mind for our continuing conversations. Before we do our next steps and close, I just want to again thank Elba and the ELACC team. You guys were phenomenal in this work. You were so dedicated, so intentional, and we couldn't have done any of this work without you. Thank you for sharing your experiences in this project, your expertise with the audience. And everybody, like, if you need to hit up ELACC, like, they are amazing and do so much work. So feel free, connect with them, follow them on Twitter, follow them on Facebook. They're amazing, put out so much great material. I want to thank everybody today for joining our call. My name is Laura. Again, you can reach me at lyepes@prosperitynow.org. We want to invite you to join the Financial Security Network. This is our brand new network. You have access to national peers and experts on financial security. You can receive direct information, join virtual and in-person events on asset building, guaranteed income, and narrative change, advocate for increased equitable distribution of wealth, income building, predatory lending restrictions, and more. Participate in working groups focused on applying a racial equity strategy to wealth building and partnering with Prosperity Now as a whole. We also invite you to join our campaigns. The campaigns and advocacy center really help us learn from you all and elevate the things that you all want to learn about. So please join our campaigns, our advocacy center, connect with us with our networks, become a community partner for community change. Woo. And also just a great big thank you to everybody on our project team, Ariel and Kara Bergman, Simone, and Parker. Thank you so much to Lisa and the Wells Fargo Foundation for supporting this work and for guiding us when we need it. And thank you so much for everybody who joined us today on the call. We were just so grateful for you all to show up. Please complete our survey at the end of the call. It just helps us, and make sure to write other things you're interested. This is the first of our financial security webinars, but it is not the last. We will be continuing. So let us know what else you want to hear about, what other work you want us to elevate, and who else needs to be highlighted on this platform. Thank you guys so much for joining. Have a good day. Be well, stay safe, and please keep your distance. Thank you so much, everybody. Have a great day.